Welcome to the Fight to Win High BP. This episode involves people with high blood pressure plus diabetes. Now, India is facing a real crisis, and we are not talking about war or terrorism here. We are talking about the deluge of heart disease. There's a significant increase in the number of heart disease in India. In fact, it is estimated that about 30 million people suffer from heart disease in India. And not just that, 25% of all deaths in India are secondary to heart disease. So you might ask, why is there so much of increase in heart disease in India? The answer is simple. It's the change in our lifestyle. Today, we don't walk, most of us. We travel in a mechanized transport to our workplace and office. We eat the wrong kind of food. And these lifestyle changes automatically result in a significant increase in conditions like high blood pressure and diabetes. Now, can you imagine that about 200 million people today in India have high blood pressure, and about 70 million have diabetes? Huge numbers. So today we have a star-studded panel with us to talk to us about this combination of hypertension and diabetes. We have Dr. Rajiv Gupta here. He is a very well-known epidemiologist in India. He presently heads the Department of Preventive Cardiology at the Eternal Heart Center at Jaipur. Welcome, Dr. Rajiv. We have Dr. Vivek Sundaram from down south Trichy. He is a physician working in Sundaram Hospital at Trichy. And then we have Dr. S.N. Narsinghan. He is from Chennai. He is the former professor of Tamil Nadu MGR University. He has done a lot of work on hypertension. He has a lot of papers published on hypertension. He's an expert on hypertension. Welcome, Dr. Narsinghan. And finally, we have Dr. Anil Gombar. He is from New Delhi. He is a physician who has done a lot of work on diabetes-related field and also on hypertension and preventive cardiology. Welcome, colleagues, to this program on Fight to Win High Blood Pressure. Now we start with the first question goes to Dr. Rajiv. Obviously, we have this hypertension, we have diabetes. What would you see, Dr. Rajiv Gupta, the effect of these two risk factors, since you are an epidemiologist, on the Indian scenario?
See, as you rightly said, that heart disease and diabetes and hypertension both are increasing tremendously and rapidly in our population across the country. We have 200 million people with high blood pressure, defined by blood pressure of 140/90. We have almost 65-70 million people with diabetes, and then almost 300 million people with with heart disease. Now, this deadly triangle is basically because of the metabolic relationship between these three conditions, which one leads to the other. There is a huge amount of variation in the prevalence of these diseases across the country, and is more hypertension, for example, is more among the North Indian population, Punjab, Himachal, Northeast population, and South India, while diabetes is much more among the South Indian population. They all are related to the lifestyle changes, and lifestyle basically I mean three major issues. One is increasing obesity, which leads to high blood pressure, high salt consumption, which again leads to high blood pressure, and specific factors related to diabetes. So I think this is a triangle which is a problem.
Yeah, but hold on there. Normally, whenever I see a map of India pertaining to epidemiology, I always find that down south, the colors are more red, they're more denser, meaning that high blood pressure and diabetes, and of course, as a consequence, heart disease, has a tendency to precipitate on to the southern states. So, Dr. Vivek, you are from south. Would you tell us about how would you basically screen a person who have high blood pressure and diabetes? Because these are the people who are likely to progress onto heart disease.
As implied by Dr. Rajiv, we Indians are at a potential high risk for diabetes and hypertension. And what is lacking is a comprehensive and effective screening process. The current recommendation is all Indians above the age of 30 years should be screened to rule out hypertension as well as diabetes at any first point of contact healthcare facility. Let it be a primary health center, the general practitioner, or any private or government hospital as such. You check your blood pressure, and to rule out diabetes, you do a fasting blood sugar. Repeat the blood glucose value after consuming 75 grams of glucose. It's called the glucose tolerance test, by which you can rule out diabetes. But a very common misconception is patients either defer screening because they claim they have no symptoms, or they do not have a positive family history. No one in the family does. But let me make it clear. Diabetes and hypertension produce symptoms only when they are grossly uncontrolled. It is mostly silent. It is a silent killer. So irrespective of this background, you need to have an effective screening process. All Indians above the age of 30 have to be screened to rule out diabetes as well as hypertension.
Now, what exactly, Dr. Narasimhan, would you tell us, what exactly is the effect of high blood pressure and this combination with diabetes on the heart?
Hypertension itself is a major risk factor for heart disease. Equally, diabetes is also yet another risk factor for heart disease. When they are combined, then they will have more burden to the heart. Hypertension itself can precipitate an enlargement of the heart, particularly one part of the heart, that is the left ventricle, which pushes the blood to the major artery. This goes on enlarging and ends in failure. It's called heart failure. So much so, you also get a burden in the heart due to coronary artery disease, what we call as ischemic heart disease or heart attack. The coronary artery disease is the one that gets actually due to the narrowing of the blood vessels as a result of high blood pressure. This actually adds to the problem of diabetes, which goes uncontrolled. All these complications can arise as a result of the combination of these two risk factors.
Yeah, I think that is important, that in multiple ways, high blood pressure and diabetes can affect the heart, and perhaps one of the most dangerous is that the cardiac problem may be silent, okay. But let's not forget that apart from the heart, we always look at the heart, heart of the matter. But if we look away from the heart, hypertension and diabetes tends to affect so many other organs. Dr. Gombar, would you tell us about the other afflictions, the brain, the eyesight, the kidneys?
Dr. Nair, it's a very good question being asked day to day in day-to-day life, that hypertension and diabetes is the two comorbid conditions is affecting the whole body. From head to toe, I can say that it is producing brain changes in the form of stroke, fundal changes in the eye changes, heart changes, as very rightly said, again, nephropathy, rather renal problems, and peripheral vascular disease. All these affecting from the whole, from head to toe. The diabetes and hypertension is affecting in a very higher way. You can say, as per se, hypertension alone or diabetes alone, making 1 + 1 is 2. No, it is here, it is 1 + 1 is 11 times more problems for the person.
Hypertension is a real challenging problem. We have learnt a lot, but more to come. Let us see after the break.
The hopes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, as USV, you before we, as USV.
USV, your reliable healthcare partner.
Welcome back after the break. We come back to our questions to know whether I have high blood pressure or high blood sugar. we need a cutoff number, right? Now, Dr. Vivek, could you tell us one simple number to remember beyond which I should be worried? I should go to you and get a checkup done. What would be the numbers for cutoff for blood pressure and blood sugar?
We need to be very clear that you are diagnosed with high blood pressure, systemic hypertension, if your blood pressure is more than 140 by 90. And while on therapy, your target blood pressure is 130 by 80. This is regarding your BP. For diabetes, while on effective therapy, your target blood glucose in the fasting state is less than 130, and 2-hour glucose value following a meal is less than 180. And you also have HbA1c, which is the average blood glucose over the past 3 months. Your target HbA1c is less than 7%. Now, these are not very stringent values regarding glycemic control. In a young diabetic who has a long lifespan, you probably should aim for more stringent, much stricter levels such as less than 6.5. Whereas in older age or severe comorbidities or already established target organ damage, a reasonably more lenient approach to a A1C around 8 is around 8 to 8.5 should be fine.
Okay, let's say, unfortunately, I have become a diabetic and an hypertensive. But let me tell you, I am scared of taking pills. Everybody is. Ask any patient, you would say, okay, doctor, can I still avoid taking pills or injections or tablets? Okay, right. So, Dr. Rajiv Gupta, you are a person in epidemiology. Would you tell us about how we can handle a problem of high blood pressure and diabetes with just changing our lifestyle? Okay, suppose I tell you, okay, I would go and do exercise, I would take a good diet. Will that help?
Yeah, I think we need to remember that lifestyle changes are the fundamental blocks of blood pressure and diabetes management. They not only prevent the disease, but they also control the disease. So at both levels they are important. And there are 3 major lifestyle changes which are important. The first, of course, is diet, and every one of my patients ask the diet question. I tell them 3 things. One is promote healthy food. So healthy food will mean lots of fruits, lots of vegetables, and both of them should be in a raw form, not in a very cooked form. The other question is about oils and fats. And oils and fats are healthy as well as unhealthy, but there should be a judicious mixture. We need to consume more of unsaturated fats, which are vegetable oils, and consume less of saturated fats, which are milk-derived fats or the animal-derived fats. The third thing important is to remember that trans fats or trans fatty acids are the worst thing which can happen to you. So do not consume any hydrogenated fats. Other question is about salt. So salt is very crucial in high blood pressure management. What you need to remember is that salt has an upper limit as well as a lower limit. In a typical Indian diet, we consume about 10 to 12 grams of salt per day. We need to reduce it to about 5 to 6. So reduce salt by half, but don't go below that because even lower levels are maybe harmful, especially in a hot country like India. And the more important thing is the physical activity. Be active. Activity could be at various levels. You could be walking or what we call as leisure time physical activity. And what is recommended is 30 minutes of walking every day. Normally WHO, the World Health Organization, recommends 30 minutes 5 days a week, but I recommend 30 minutes 7 days a week or possibly 8 days a week, twice a week on Sunday, twice a day on Sundays actually. So walking, physical activity is very important for prevention and control.
Now, from that, isn't it true that most people would still need medications rather than lifestyle? And if that is so, Dr. Gombar, would you tell us, are these medicines that large number of specialists, including all of you and me too, right, are they generally safe?
Yeah. Almost by and large, all the medications are quite safe in hypertension with diabetes, but few of the medicines are to be seen with some parameters of the body. Like if the person is having a heart failure, we have to avoid some oral anti-hypoglycemic agents, right? If the person is having some renal dysfunction, we have to avoid some medications. By and large, all oral hypoglycemic agents are safe. Second thing is an insulin, which is a very important hallmark of a diabetic patient, is also very safe in almost all sets of diabetics.
One thing is that, literature says that 1 out of 5 Indians are overweight. So I think this is an unusual panel, 1, 2, 3, 4, 5, and everybody looks fighting fit and thin. But obesity, overweight, is becoming a real problem in India. Dr. Vivek, would you elaborate on that? What would be its effect in a person who already has a tendency for high blood pressure, blood sugar, and he now is overweight?
Yeah, definitely. It is a well-known fact now, obesity definitely takes a toll on the heart's health. We have plethora of data to support it. Now, we do know a person who is obese has a much shorter lifespan compared to a person who is normal weight. Now, with obesity, there is also an increased risk of you manifesting a cluster of heart disease risk factors, such as blood pressure, hypertension, and high cholesterol. Now, all these, as such, would compound your risk of heart disease. Despite these risk factors, obesity per se would also contribute to eroding your arterial walls. Obesity is akin to broken glass in your wall of your arteries. In India, it is not only generalized obesity, but also your belly fat, your abdominal obesity, that is an independent risk factor for heart disease. But this is not always bad news. On the brighter side of it, if you slim down, if you aggressively reduce weight, you can decrease the risk. Or rather, if you're looking at cure, if you significantly decrease your body weight, now we do know at least 50% of them can at least reverse diabetes. So as it is said, obesity is not a disease, it is rather a bad habit.
True. But the moment usual layman, a person hears about obesity, sees a person who's overweight, thinks of cholesterol. Now, Dr. Narasimhan, would you tell us about this cholesterol background, which is so very important, we have not discussed that, in a person who already has high blood pressure and diabetes?
Thank you for initiating this sort of information. Because cholesterol plays a very important role, central role in so-called fat accumulation in the arteries, ending in a cardiovascular event. It plays a very vital role. Over and above, you do get problems of hypertension and diabetes. All these risk factors aggravate the problem of accumulation of fat in the arteries. The fat deposition goes and occludes the blood vessels, and suddenly the people can get into heart attack. They can go for stroke events also. In fact, if you look at people who are obese, they generate a lot of atherogenic cholesterols. We call that atherogenic cholesterol in the form high triglycerides, low HDL, increased proportion of the bad cholesterol, LDL cholesterol. All these components of the cholesterol are responsible for increasing number of heart disease in our country. That is most important.
Yeah, but then one thing we have forgotten is smoking. I mean, obviously we all know smoking is harmful, smoking is bad. But the point is, many patients come and tell us, Doctor, I have hypertension and diabetes. I really don't smoke, but just 2 cigarettes. So, Dr. Gombar, would you tell us that is 2 cigarettes really dangerous in a background of a person who is already a hypertensive and a diabetic?
Smoking is a very important risk factor for diabetes and hypertension per se. The other very important risk factor for producing an atherosclerosis early, with producing stiffness of the arteries, and it is an important risk factor for heart disease, very important heart disease, and it is increasing the vascular health. It is decreasing the vascular health of the body as a whole. So smoking as such is very dangerous, is a very important risk factor, even 1 smoke or even 10 smoke.
The question comes in is that normally we say women are protected from heart disease and their main problem would be breast cancer, uterine cancer. But today we have data to tell us that heart disease is quite prevalent in them if they have the background of hypertension and diabetes. Dr. Rajiv Gupta, would you tell us about this connection between women and heart disease?
Yeah, I think it's very important to realize that the most common cause, the most important cause of death and disability in women is heart disease. And many people don't realize it. Both the World Health Organization and various national organizations have now started the focus on women having heart disease. All over the world, including India, post-menopausal women have more heart disease as compared to men. What we also need to remember is that both high blood pressure and diabetes are more common in women as compared to men, especially after their menopausal age. Before menopause, they are somehow protected because of the hormonal influences against heart disease, hypertension, and diabetes. But after that, there is an exponential increase in both of these conditions. And these are major risk factors for heart disease. So I think women have to be very careful about their body weight, about their physical activity levels to prevent hypertension and heart disease.
Yeah, today we know that compared to breast cancer, heart disease kills far more women with heart attack rather than cancers. So that brings us to a question of, we hear about prevention. We have talked so much about the disease. Actually, we are scared. We hear that there are so many drugs, blood thinners, like aspirin. We talk about statins, which are basically cholesterol-lowering drugs. What beneficial effect these drugs have in preventing heart disease in a person with high blood pressure and diabetes? Dr. Narasimhan, would you tell us?
Yeah, aspirin is one of the wonderful drugs. Actually, it is a blood thinner which was prescribed in larger quantities in the past, and now we have realized that it has got no role in preventing heart disease unless the patient has got a high risk of developing a heart disease in the next 10 years or so, which will be calculated by your doctor, and you will be in a position to prescribe this drug. But people who suffer from heart attack, people who suffer from stroke, or people who had occluded their blood vessels and coming for an advice, probably they require aspirin therapy continuously. But people who are at a high risk of developing a heart attack, high risk of developing a stroke, and the doctor calculates the risk, and if it is going to be more than 10% between the ages of 50 and 59 and 60 to 70, in that case probably he is justified in giving a prescription for aspirin, or so-called aspirin in larger quantities or a smaller dose. Maybe that 75 to 100 milligrams are the one commonly being used. The larger doses are not recommended. And people who are taking aspirin, they need to be very careful about the so-called side effect of a bleeding episodes, which can occur in the brain, which can occur in the stomach also. The doctor actually weighs the benefits and the risks involved in recommending this particular therapy in an individual patient. The next drug that you were probably asking is about the cholesterol lowering drug. Many of you in this audience probably would have been given or would have been probably highlighted the importance of cholesterol lowering drugs that is called statins. Statins are the wonderful drugs. They are very safe, they are very efficacious, and lakhs and lakhs of patients have been tried on this particular molecule. It has done wonderful effect in the form of prevention of heart disease. It is a drug that can be prescribed for patients who are under the age of 40 if he is a diabetic. Under the age of 40, if you suffer from a heart attack, he requires it. Persons who suffer from heart attack, persons who suffer from stroke, they need to take statins. But people who are under the age of 40, if you are diabetic, no need to prescribe it. After the age of 40, if one additional risk factor is there, he has to receive statin. People with hypertension, probably if the pressure is not controlled, if it is seen in conjunction with diabetes, it is all the more relevant to prescribe statins. Statins are very, very safe drugs, and they are very, very efficacious, and they have done wonders in many studies which were done in the past.
Thank you. So thank you, gentlemen, for joining us, spending your valuable time with us in a fight to win against high blood pressure. The take-home message would be that blood pressure is silent. I don't know whether I have blood pressure. So is blood sugar. Unless I check it out, I don't know whether I have high blood sugar. And if we take treatment, not necessarily drugs, lifestyle changes, and if lifestyle doesn't give the good results, we go for medications. And with lifestyle and medication today, we can ensure that if our blood pressure is controlled, blood sugar is controlled, our heart, our brain, our eyes, our kidneys won't be affected, and we will not get into a problem. So the slogan would be, join hands, let us fight high blood pressure together and win. We can do it. Thank you.